Imagine it's 1830. You have a broken leg that's gone gangrenous. You aren't headed to a quiet, sterile hospital room. You're being carried into a theater filled with onlookers. Meet Robert Liston. They called him the fastest knife in the West. He could amputate a leg in under 3 minutes. Why the rush? Because every second he worked, you felt everything. No gas, no injections, no counting down from 10. Just you, a leather strap to bite on, and four strong men holding you down so you wouldn't scream your way off the table. Today, we're looking at the terrifying reality of surgery before anesthesia and the bizarre ways doctors tried to stop the pain. Humans have always hated pain, and we've been trying to turn it off for thousands of years. As far back as 200 CE, Chinese physicians like Huatuo were mixing herbal powders with wine to knock patients out. By the 13th century, surgeons used soporific sponges. These were soaked in a cocktail of opium, mandrake, and hemlock. The patient would inhale the fumes until they drifted off. But here's the kicker. For a long time, many doctors actually hated the idea of pain relief. Some believed pain was a vital stimulant that kept the heart beating during surgery. Others, like American obstetrician Charles Meigs, argued that pain, especially in childbirth, was divine suffering that doctors shouldn't mess with. This meant for centuries, speed was the only anesthesia available. If a surgeon wasn't fast, the patient usually died from the sheer shock of the pain. Then came the 1800s, and things got weird. Before they were used in hospitals, gases like nitrous oxide, laughing gas, and ether were actually party drugs. People would attend ether frolics just to get lightheaded. It wasn't until a few observant doctors noticed that people on these gases didn't feel pain when they fell or bumped into things that the light bulb finally went off. In 1846, the game changed forever. An American dentist named William Morton publicly demonstrated the use of ether to remove a tumor. The patient woke up and famously said, "I have felt no pain." But it wasn't perfect. Ether was highly flammable, not great in rooms lit by candles, and made patients vomit. Then came chloroform. It was faster and easier to use, but it had a dark side. It was incredibly easy to accidentally overdose your patient. Forever. By the early 1900s, we moved away from toxic chloroform to the sophisticated monitored cocktails used by anesthesiologists today. Now, instead of a terrifying theater of screams, surgery is a controlled state of unconsciousness that looks nothing like sleep. So, the next time you have to go under for a procedure, just remember Robert Liston and his 3-minute leg amputation. Suddenly, that hospital gown doesn't seem so bad, does it? Thanks for watching.